One more announcement.
Yeah.
This young man has traveled from Israel because he would like to, he does the same thing that I do. If you could, can you tell me about yourself real quickly?
And happy Hanukkah.
My name is Dr. Adahan. I've come here from the Tel Shomer Institute in Israel, which is in the Tel Aviv area. It's Israel's largest medical center with 1,200 beds. I run the pain rehab unit there, and about a third of the patients I see are military or terror trauma, and the vast majority suffer from PTSD. And as Dr. Lipov has mentioned, the treatments available for PTSD, although we have all of the most modern and cutting-edge treatments, and we have psychiatrists who are considered world leaders in the field, are often leaving the patients wanting. And we're very, very excited at the possibility of the development of a new, timely, quick, and effective treatment, particularly in Israel, where oftentimes in the course of military action, the soldiers are, it's very different than here, the soldiers are actually close to home. Israel being a small country and most of the wars being fought on the spot, we know that about 60% of the soldiers who suffer combat stress reaction will go on to develop chronic PTSD. And with interventions being developed by Dr. Lipov here in the United States, we believe that maybe there might be hope to prevent the development of PTSD in those subjects. So we're very excited about Dr. Lipov's groundbreaking, innovative work, and I saw well to travel 27 hours to get here.
Thank you.
And
Thank you. Thank you.
for myself on his wonderful, wonderful groundbreaking work.
Thank you. The purpose behind it is to make people aware it is possible to treat and hopefully beat PTSD. I've written a book about winning a PTSD battle, at least the beginnings of it. And I think it is possible by taking a different approach. What has been done to date has not been very effective for those of you who have been following it. There's a lot of drugs being used for it. There's a lot of cognitive therapies. Some are more effective than others. What we're trying to do is work in unison with other specialties, and that's part of the reason we're trying to do a comprehensive institute. Comprehensive in the sense that to diagnose it and then to treat it. It's not, I'm not saying a one block is going to fix everything. Jason had a great response, his soldier that we've treated, but it's going to take, I think, everybody. You need social services, you need people to get reintegrated into society, they need jobs. The institute, the function of the institute, will be to provide those services in a paramilitary section. I'm not trying to get in the VA system, which is, I don't think it's possible to move in that system. Plus, it's overburdened as is. So we're trying to provide treatments available. The first thing I need to do is get a definitive, it's called a pivotal study. Pivotal study is a blinded placebo-controlled study, which I'm high on the approved list to get that from DOD. Unfortunately, due to the 2011 budget, going through, not going through, whatever, they're still screwing around with that. So if any of you can help me get that money, that'd be wonderful. And then we're also looking for soldiers in the study I'm doing here, which I'm sponsoring through my office. So that's pretty much the story. Problem is, when I met with DARPA representatives, DARPA is supposed to be the super advanced agency. They basically go, I can give you $1 million to do it, but I'm not going to do it too. I just don't want to do it. That's their logic.
What's keeping them from doing it?
Well, well, I'll give you the answer. The problem with Walter and all the other military agencies in the United States, whoever is in charge of that military section, if something happens in their shift, their career is over. They will not allow any innovation at all. It is, stellate ganglion block is an invasive procedure. It's extremely safe procedure. Now, mind you, the same people who make the decision are administering Seroquel with a death rate 1 to 5 out of 1,000. That's not a problem. Medication death, no problem. We're good. This, bad. That's what's holding back. The other part is fragility factor. It's very hard to believe such a simple procedure can actually be effective. Well, first of all, it's not that simple, and then it's just a new understanding of it, which happens in medicine all the time. Look at penicillin. But the guy who invented penicillin in 1928 was almost kicked out of a profession because he was a heretic. But in 1940, saved 1 million lives by applying penicillin. So that's the answer.
PTSD is an immensely complex problem. And like most things in medicine, there's probably a lot more that we don't understand than what we do understand. However, I think I've developed a philosophy after 20 years in the pain rehabilitation practice, which is that simple and stupid is beautiful. For the moment, what Dr. Lipov is proposing is a very simple and elegant and safe technique. Now, if it does give the results that he's reporting that it gives, and I would have no reason to doubt him, then we would be on to something very significant indeed. So we're always in Israel trying to be innovative and trying to think outside the box. Dr. Eugene Lipov has done a tremendous job of thinking outside the box here, and we might even go further. So let's see what we can do together.
Do you mind just being an audience and not speak? Is that okay? Perfect.
Good. Let me get a picture. You and Carrie.
Okay, no
I'm
problem.
the publicist.
Publicist. I'll try not to break the camera.
You did a perfect job.